Welcome to Valley Hip and Knee Institute, home of Dr. Herbert Huddleston and Dr. Eric Zegan, a nationally recognized team of board-certified orthopedic surgeons. With more than 40 years of combined experience, they have performed over 15,000 successful hip and knee procedures, helping patients live active, healthier lives.
So what brings you in today?
Well, over the past 6 months or so, I've really had severe hip pain, and it's gotten to the point where it's really affected my lifestyle. Trouble sleeping, doing anything athletic or at the gym is out of the question, and it's just gotten to the point where it's intolerable.
Where is the pain?
It does travel. Most of it's located up actually around where my hip is, but if I'm sitting for a long time or I'm driving and I get out, I'll get a shooting pain down the leg. Basically, in the last 6 months, the quality of my life has really deteriorated. I think one of the main problems is lack of sleep, because I roll over on the hip and the pain of it wakes me up. And in terms of that lack of sleep, affects the rest of your day.
Yeah, pretty good range of motion there.
Yeah.
This side?
It's a little different.
Different.
Yeah. So when you get it up there, it kind of
Going. Starting on the left hip, you can see there's still a healthy amount of space between the ball and the socket, and that represents the normal healthy cartilage. But when we look at the right hip, you can see quite a diminished joint space. That indicates that the cartilage has worn off, and you're bone on bone here with some bone spurs here and here. I would categorize this as severe osteoarthritis of your right hip. Over time, it just gets worse and worse, and things like anti-inflammatories and activity modifications, physical therapy, they become less and less effective. I think a hip replacement would improve your quality of life considerably.
Okay.
Chris had a total hip replacement. The anterior approach is somewhat of a newer approach to hip replacement surgery. It differs from the traditional posterior approach in that we're coming in through the front of the hip, and instead of detaching muscles or tendons, we're just spreading the muscles apart. This facilitates a quicker recovery for the patient. We've recreated the ball and socket joint here. It involves two parts. The first part is on the socket side, or acetabulum, where we are placing a new socket for the patient. We impact a metal shell into the patient's own pelvis, and over time the bone will grow onto the metal. On the femoral side, we've removed the femoral head by making a cut here and hollow out the inside of the femur to prepare it so that the stem can be wedged in there, and just like on the socket, we get a press fit and the stem is in there quite snug, and over time the bone will grow onto the prosthesis. So then when we're done, the patient now has a new smooth articulation.
Close by, on the Valley Presbyterian campus, is the Hip and Knee Institute's Comprehensive Rehabilitation Center.
I would say on average people take about 4 to 6 weeks to recover from this surgery. At that point, most people are walking independent of a cane or a walker, and really getting back on with their life, doing more active things.
Will I be able to play like ice hockey again?
Yeah, I think you'd be able to get back to playing. So about 4 months after your surgery, we've implanted a new ball and socket, and here's the stem going down. Looks great.
Along with the pain being gone, it allows me to do more and more things that I used to be able to do. So in a lot of ways, I have a new hip, but it gave me my old life back.
You've got problems with your right knee?
Oh, yes.
Do you get pain with every step that you take?
Pain with every step.
No other joint problems, right?
No.
Okay. All right, Gwen, if you don't mind, I'm going to just examine your knee and see how it works, all right? Now, let's straighten it out. Does it hurt? Okay. Let's bend it as far as it'll go.
Ow.
I'm sorry. All right, let me see what the ligaments are doing. Yeah, you've got good ligaments, no problem there. Let me see your hip. Hip moves fine. Thank you very much. Now, there should be clear space between the two bones, about 1/4 of an inch of clear space, and you can see there's no clear space between the two bones at all. And you can see how irregular your thigh bone is, where the two parts meet each other. That's very irregular, and that constitutes arthritis. Knee replacement used to be incredibly painful, and it would take about a year to recover. Fortunately, we've had great improvements in the past 4 years. One of the things we do now we didn't do before is, before we close the wound, we inject all the soft tissues with a mixture of long-acting anesthetic an anti-inflammatory, some morphine, and another medication. For the first 3 days after surgery, you'll have almost no pain. Now, the way we used to do the surgery was, once we got under the skin, we split these tendons from each other here, and when we got to the top of the kneecap, we cut straight into that tendon and up between the two muscles. Now, what we do now does not seem to be all that very much different. The bottom end of that incision is still the same. We split these tendons from each other. But when we get to the top of the kneecap, instead of cutting up into that tendon, we simply split the muscle fibers this way, and then we can flip the kneecap out of the way and do the surgery. Many patients can walk the next day without a cane or anything.
Wow, that's amazing.
Good morning, Gwen.
Good morning, Dr. Huddleston.
How are you, honey?
I'm just wonderful. I had my surgery yesterday at 7:30.
Lift it up, bend it, and straighten it. Oh my, how much pain do you have?
None.
Have you had any pain since surgery?
No. And I walked all the way around the hallway and back to my room.
When we say knee replacement, most people think we chop out 3 inches of bone on each side of the knee and put in a whole big metal and plastic knee. This really should be called a resurfacing of the knee, because all we do is we cut off a very thin layer of bone, and then we put a cap on the shin bone and a cap on the thigh bone. The amount of bone removed is just as thick as the metal cap, which is perhaps less than 1/3 of an inch. So after we shape the lower end of the thigh bone, we slide this metal cap onto it and cement it in place. On the shin bone, we remove also about 1/3 of an inch of bone and replace it with that metal cap. Then sandwiched between the two is this plastic piece. Now this is a very special knee because most knee replacements move like a hinge, but this one has a mobile bearing in it, so it works like a universal joint, and that gives a more natural feel to the knee and a better range of motion. Straighten it all the way and put it down. Mrs. Avila, how long is it since your surgery now?
Señora Vila, ¿cuándo hace de su cirugía?
3 meses.
3 months.
How's it been going?
¿Y cómo le han estado yendo?
Muy bien.
How much pain did you have after the surgery?
¿Tuvo mucho dolor después de la cirugía?
No.
Carmen and Gwen went through their surgeries, just sailed through it. They had absolutely no problems. They had an excellent result. Neither one of them had any pain after the surgery. They're both very pleased with the surgeries, and they both feel that their knee feels like a normal knee.
From the first appointment to the completion of physical therapy, the doctors at the Valley Hip and Knee Institute are committed to providing each patient with the specialized care they need to get back in action. If joint pain is slowing you down, give us a call. It's time to get moving.